Hello, welcome to today's episode of Clinical Vignettes. Today we have the case of a woman in her 60s who has rheumatoid arthritis and is maintained on methotrexate, low-dose methotrexate once weekly. She is now admitted in the hospital with acute kidney injury, and she is incidentally found to have pancytopenia. And so we are consulted to evaluate pancytopenia, and specifically the team requests a bone marrow biopsy. So, do we do this bone marrow biopsy in this patient with pancytopenia? So, methotrexate in low doses does not cause pancytopenia, usually, unless there is excess methotrexate that causes methotrexate toxicity. So, in this patient who has acute kidney injury, this is a patient who's at risk for methotrexate toxicity because methotrexate is primarily cleared through the kidneys. And so we did ask them to check levels, and methotrexate levels were found to be elevated, and we recommended leucovorin rescue. So this patient was placed on leucovorin until methotrexate levels were found to be undetectable. So to answer the question as to whether a bone marrow biopsy is needed, the answer is no. So pancytopenia is a known toxicity associated with excess methotrexate. And what we would want to do is really give the bone marrow time to recover from the toxic injury of the methotrexate. And so in this patient, a bone marrow biopsy is not indicated because there is a clear cause of methotrexate toxicity. We would want to wait for bone marrow recovery, which we would expect to happen with recovery of counts over at least a 21-day period, depending on the extent to which the patient was methotrexate toxic. Now, teams get anxious in the hospital because they want patients to go home as soon as possible, and it can take a long time for patients to recover from the pancytopenia associated with methotrexate toxicity. So sometimes, if clinically indicated, we will consider whether supportive therapy with G-CSF or erythropoietin is necessary. For the most part, though, you know that they're going to recover counts over time, and really patience is what is most needed. All right, so in the 60-something-year-old person who presented with pancytopenia in the setting of methotrexate use with acute kidney injury, it is most likely that this is methotrexate toxicity causing pancytopenia, and no extensive evaluation is needed. However, to exercise due diligence, it does make sense to look to see if she has all the building blocks for her counts to recover. And so in these patients, we would want to make sure that we check B12, we check folate, and that we check iron studies as well. Because if nutritional deficiencies exist, it may take time for recovery. All right, that ends today's case. Pleasure to talk to you today. Thank you for watching.